Hi, my name is Dr. Onye Nnorom, aka Dr.O, and I want to talk to you today about patient empowerment. Now, what is patient empowerment? It's basically being able to advocate for yourself in a healthcare setting. Has this ever happened to you? Like you might be in the waiting room and your heart is beating, you want to talk to the doctor about something going on with you or many things, but you're flustered, you're anxious, or if there's been a time in your life where you had a bad experience in healthcare, you are feeling anxiety. So this series is about how to navigate those feelings, that space, and get the kind of care that you need. Because at the end of the day, the best advocate for your health is actually you. As a family physician, public health specialist, and medical educator, I've seen firsthand the challenges that people face when they feel unheard or ignored or misunderstood in healthcare. Now, real talk, healthcare systems pretty much everywhere are overburdened, and healthcare providers and doctors are in short supply. I acknowledge that is a challenge in and of itself. However, I think this information on patient empowerment is needed now more than ever. Before we jump into empowerment, I also want to talk about folks who feel unempowered in our healthcare systems. And that tends to be people who have had bad experiences in healthcare, or people whose communities or history has involved bad experiences in healthcare. And that tends to be women, indigenous people, Black people, and other racialized people, LGBTQ2S+, and basically almost any group that has experienced marginalization or structural oppression has had bad experiences in healthcare. And so tend to feel really unempowered when you walk into a clinical space. Regardless of the cause, feelings of mistrust and not feeling empowered in the healthcare system are very common. However, it is possible to feel in control of your health and to take control of what is happening to you, even, yes, during a time like this where primary care providers are in short supply. You can still take control of your health. So what am I going to be talking to you about in this series? Well, it's really three things. The first is self-awareness, the second is self-advocacy, and the third is system awareness. So what do I mean by that? Self-awareness is specifically for those who have had negative experiences in healthcare, and so that you can kind of pinpoint it and understand where that came from and how you want to navigate the system and overcome that. The second is self-advocacy, so knowing how to speak to a doctor or your nurse practitioner to be able to get your goals across. And then the third is system awareness. So understanding how healthcare systems work or how the clinic functions, or even just how to recognize signs that this might be a safe space, or how you want to navigate it if it's not the most emotionally safe space for you. By the end of this series, you will have the tools that you need to advocate for yourself and feel empowered in any healthcare system. So I am committed to seeing you get the care that you deserve. Please grab a pen and paper, subscribe and follow us on Health Caring Differently, and I will walk us through this journey. For my students, my Health Caring Differently learners, this series is for you too, because even if you're not a patient in the system very often, you want to serve patients. You want to be a healthcare provider, and you also want to help your friends and your family navigate healthcare. So I expect you to tune into this series too. Remember, you got this.